in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. Joining us today is the Honourable John Haggie, Minister of Health and Community Services. Please stand by. Our news conference will begin shortly.
The update that she would normally. As of 9 o'clock today, September the 29th, we have no new cases of COVID-19 reported. We currently have 2 active cases. We've had a total of 273 confirmed cases of the virus. 268 people have now recovered, and in total, we've tested 41,471. Before I begin my remarks today, I'd like to recognize 2 things. One is later on this week is the start of World Breastfeeding Week. This is a really crucial public health and wellness initiative that is gaining traction in Newfoundland and Labrador. We have done very well over the last couple of decades, seeing an increase from 1/3 of newborn babies beginning breastfeeding to now 3/4 of newborns at least begin to try the process of breastfeeding. And it's important that we and our partners continue to promote that, both from a public health point of view and the immunity it provides, as well as general wellness, because it's an excellent start in life for new Newfoundlanders and Labradorians. The other occasion I'd like to mark is less happy. Recently, Dr. Ron Whalen passed away. He was a radiologist at St. Clair's and probably would be happier being remembered as an avid sailor. He was one of only 3 presidents of the Canadian Medical Association to come from Newfoundland and Labrador. First was Dr. Roberts, and I was the last of the 3. We met many times, and Ron always had insights on healthcare, which I, at the time as a new representative of the NLMA to the Canadian Forum, found very valuable. And I would like to send my condolences to his wife and to his family. I've lost a friend, they've lost a father and a loved one, and the medical community is the poorer for his passing. So farewell, Ron. In terms of my comments today, really, I want to draw some parallels, I think, between Newfoundland and Labrador currently and what is happening in the rest of the world and the rest of Canada. We, through the efforts of each and every one of you, have done very well in bringing COVID to a stage where life can begin to take on more of its pre-COVID facets. We cannot, however, let our guard down, and simply because the news most days is reassuring, we can't forget the important public health measures that Dr. Fitzgerald and the panels here over the course of the last few months have been emphasizing. Good hand washing technique, good sneeze and cough etiquette. We need to physically distance, and where that is not possible, then use a cloth mask. These are best summed up in Dr. Fitzgerald's mantra of people, space, time, and place. And that's your decision matrix to help you and your family decide on the situations that you choose to go to. Quebec today has announced over 790 new cases. It had 750 yesterday. Ontario announced a daytime record yesterday of 700 new cases. British Columbia, 267 cases. There is a resurgence of COVID in areas where control was felt to have been achieved. We are an area where we feel COVID has been controlled, but we still see sporadic cases, and we need to be ever on our guard about the possibility that this could come here in numbers such as we saw in March and April of this year. So again, it is tempting, because our numbers are so good, to feel a sense of relaxation and maybe even complacency. But the facts of the case are we can't let our guard down. Our plan is life with COVID in Newfoundland and Labrador, and it will be with us yet for some time to come. And the rest of the country, I think, acts as something of a yardstick and maybe a warning to us too. You've seen the Prime Minister here change the conversation with his address to the nation last week about the fall being a different kind of fall. You've seen the Taoiseach, the elected leader in Ireland, say pretty much the same kind of thing. And I think, we just need to bear that in mind when we feel a little maybe complacent and a little bit self-congratulatory. We have done well, but we need to maintain our guard and keep it up. Again, I'll close by saying people, space, time and place. Keep your distance. If you're moving and you're in public, wear a mask. And we need to continue to hold the line. So with that, Kathy, I'll pause there and hand it over to you for the question and answer period.
Thank you. For your benefit, Minister, we have 5 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. If time permits, there will be an opportunity for further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed towards the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Jody Cook of NTV News. Please go ahead.
Hi, Minister Haggie. We've been roughly a month into our availability of having the Newfoundland and Labrador COVID-19 app. I'm wondering if you could update us on the uptake on that.
Certainly, there has been an uptake. The figures, because paradoxically of privacy, are provided by the federal government and are not broken down by jurisdictions. The last figure I saw, which was a little while ago, was over 21 million. I would have to go back and get a more detailed figure. I'm happy to do that for you.
Sorry, I just missed the tail end of that. But my next question for you is, yesterday I understand that you met with a number of long-term care facility providers, talking a little bit about some of the challenges that continue to exist in the operations in a number of those facilities here in this province. Can you update us a little bit more on the conversation that you had with them, some of the issues that arose, and some of the mitigation there?
Yeah, I mean, that was a meeting at a staff level. I personally wasn't involved in that. The issues that have been brought to my attention have been around matters of overtime and administration costs, cleaning costs, and the potential for future restrictions around the one worker, one home policy. Certainly happy to provide a more detailed statement when I've had a chance to debrief with the staff who were involved in that conversation.
Thank you. And then finally,
Jody, that was your 2 questions. The next round, you can ask your next question. Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi.
Hi.
There's at least one local clinic in Springdale now providing antigen tests for COVID-19. Is this something that the province is still considering, and what purpose would it serve if you did?
We are, as a province, subscribers to the National COVID Immunity Task Force or Working Group. They have a variety of projects, research-based across the country, looking at antibody prevalence. They started actually with blood collections that were done over the period since the start of the pandemic to look to see if they could figure out what proportion of the population are likely to have been exposed to COVID and developed immunity. I can't speak to the specifics of that. Memorial here is our lead through that task force. Whether or not that particular clinic has been involved with some private sample collection for a different research project, I think would be a question better directed to them. At the moment, the issue of the use of antibody testing is still a subject of research, and how you would use the data is still speculative.
Okay, thank you. Health Canada today said it has not approved any of the number of tests, either rapid tests or home tests, that are waiting approval. Do you feel that this delay is going to affect our ability to rapidly address COVID testing, or are you happy with Health Canada's slow and steady approach?
We have to rely on Health Canada's licensing system. There are already several orders in council at the federal level which allow Health Canada to abbreviate or to shorten the licensing period for new COVID-related technology. I think it is far better for the general public to have a test that is known to be reliable and accurate rather than to simply have some released on the market. We saw an attempt to do that early on in the COVID crisis, and that really was rapidly pulled back by Health Canada, and I think they kind of got their fingers burnt on that. The rapid test kits will have a role, but it really depends on what their accuracy and sensitivity is, and that data will come from Health Canada's licensing work. So we need that to figure out how best to use these kits, because they are not necessarily going to provide the same kind of information as our diagnostic kits, but whether or not they'll be usable for screening is the big question, because I think that's everyone's hope, is that you can somehow stick these machines at a point of entry and get an answer to show whether or not someone's got COVID and whether or not they will ever develop it. And at the moment, that test does not exist. So we are relying on what we have in place at the moment, which is evidence-based, based on public health best practice. The only screening test that is accurate, that works for COVID-19, is isolation for the incubation period.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Fortunately, this province hasn't seen numbers rising like we've seen elsewhere, but what is the healthcare system and public health doing to prepare in case that does happen?
We have a very good, very well-trained core of public health nurses and communicable disease nurses who do the contact tracing. If you look at other jurisdictions' experience, and if you look at our own with the clusters that we've had, we have promptly identified contacts and promptly had them tested with metrics that are as good as, if not the best in the country. And that has what has enabled us to bring COVID under control in that fashion. That is and will be the mainstay. We have lab capacity. We're working to increase that still further, both in terms of new equipment purchases as well as cross-training other technicians and technologists so that we have that capacity. Other than that, our best defense is the things that people in this province have actually been doing. That is keeping your distance, wearing your mask, isolating after travel. That has worked and continues to reap benefits. In terms of the capacity of the healthcare system, we know that we can mobilize adequate resources very quickly, probably quicker than we had anticipated when we closed down some of the healthcare facilities early on in March of last year. So we have a little bit more freedom now, we feel, to be able to continue to deal with the backlog. And we have several areas of the regional health authorities now that are working well over 100% compared with the seasonal figures for this year. So the capacity exists. I think we just have to avoid getting too complacent and keep an eye on what's happening.
Peter, before you go to your second question, I'm asking all reporters if they would put their lines on mute because we're getting some interference there. So when your name is called, you can just take your line off mute. So, Peter, go ahead.
Thanks, Kathy. In other provinces where they've seen those cases climb, they've done lockdowns based on regions to try and target just the areas where the resurgences are to allow other areas to continue. So if we did start to see cases climb here, what would the plan be, considering we haven't used a regionalized approach, at least to date?
That's a very good question. Certainly that would be our preferred route should we find ourselves in a similar situation. That's one of the changes, one of the learnings that we've had as a result of our own experiences with COVID, but also watching other jurisdictions. And depending on the pattern of the disease, should it come back, it may be possible to do it by community or by region. And that is a prominent idea at the moment in public health response should that happen.
Thank you.
Our next questions are from Linda Swain of VOCM News. Please go ahead.
Hi, good afternoon. Did any more people come forward as a result of that advisory issued to travelers last week in connection with the latest positive case?
I'm not aware that we have. They would come forward through 811 initially, and not everybody who was necessarily on that flight would be in need of a test. We are not aware of a significant surge in testing as a result of those flights.
Will the pilot project easing restrictions on rotational workers be extended or further modified?
That pilot project is due to end, I think, 6th or 7th of October, and then there'll probably be about a week or so of analysis. So unless something drastic happens in the meantime, that's the decision time frame on that pilot.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
So just on that last question, just to understand, so that would mean that if a decision will be taken after the first 4 weeks, then the program will be extended at least until such a decision will be made?
We will not change anything until the evaluation is complete. So it will take a week to do that. My understanding from what Dr. Fitzgerald said on the last occasion certainly was that we would leave the status quo until there was an indication that it needed changing or revising.
Okay, thank you. I'd also like to ask a question about the rigidity of rules related to ID cards for travelers coming from the Atlantic bubble. There's been some situations where people have shown up at the airport and not had a government ID that shows their address, but have had other forms of proof of ID, such as letters or bills, things like that clearly show that they're from the Atlantic bubble, that they're residents of the region. Is that something that you're looking to change? Because there are a lot of people out there who might not have an ID card issued by government of Atlantic Canada, but who have every right to come to Newfoundland under the rule.
Yeah, I mean, there are a variety of forms of documentation that are acceptable. The passport is not, because it doesn't have the required proof of residency. Driver's licenses, healthcare card is as well, because by and large, the definition of a recipient of a province's healthcare services is someone who is in law ordinarily resident. So there isn't just those. There are a variety, and there's also a possibility of an on-the-spot exemption in extenuating circumstances, which would require approval from the duty medical officer of health. But really and honestly, we feel that we have a broader range of documentation that will satisfy the requirements as any jurisdiction, and I believe it's fairly consistent across Atlantic Canada.
We'll now move on to round 2 of questions, where each reporter will again be given the opportunity to ask one question and one follow-up. We'll start with Jody Cook of NTV News. Please go ahead.
Thank you. Just a little bit based on what you talked about earlier, Minister Haggie, on the capacity with the lab and more freedom to deal with some of the backlogs, feeling like you're well positioned right now. With the consideration that many residents are already looking forward to December and wanting to reunite with some of their family and loved ones, what is the chance that between now and then there might be some consideration or talks about this Atlantic bubble, even if it means those who come outside of it are forced to self-isolate for 2 weeks?
Certainly from the point of view of risk of introducing the virus or a resurgence, still the evidence from our own experience and from the experience of other jurisdictions in Canada is that it's likely to be travel related in the early stages. So travel has always been a source of intense scrutiny for our public health team. The question then is, where are you traveling from? And other jurisdictions have adopted an approach whereby they have said, hotspots we will keep out. Some, I think over 110 jurisdictions internationally have simply banned travel The ratio of those people who've been selective in allowing people in to those who've just had a blanket ban has changed over the course of COVID. If you look at the rest of Canada, that will be the main determinant, I think, as to whether or not folk from outside the Atlantic bubble would be reconsidered in terms of travel. And if you look at the figures I read out at the beginning, there's certainly 4 major areas of concern there.
Thank you.
Do you have another question?
Sorry, yeah, thanks. The Canadian Medical Association's raised concerns about the challenges doctors face ahead of the second wave with securing PPE, as you mentioned, with those outbreaks across the country, and then provisions needed to be shared around provincially. Do we have any concerns here about the supply chain, or are we fairly set up?
We have used a process of inventory control to allow us to keep a stockpile, for want of a better word. It's not the way it was done before, which didn't work, quite frankly. Basically, the supplies come in at one end of a big warehouse and go out at the other and move down the warehouse. And that size of warehouse allows you your surge capacity. We are in a pretty good place at the moment between the fact that our pandemic orders from January have started to arrive and the fact in some areas we've got homegrown suppliers too now. So as far as the specifics about PPE for physicians, we have arrangements in place where each region has a contact person for PPE for any kind of physician's office. We also have a similar arrangement, I believe, for dentists too. So we've worked with the Medical Association and we've worked with other stakeholder groups to address their concerns about PPE. And at the moment, the demand is manageable so that we can build up this inventory hold, which will allow us to deal with the surge in the future.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hello. I'd like to revisit long-term care for a moment. The conventional wisdom seems to be that we dodged a bullet with COVID, partially because of the way we handle things and partially because out of luck. But given the demands that your department finally sort of gave an ear to last week about staffing and our budget crunch coming tomorrow, how likely is it that the immediate demands for more robust staffing will be addressed within the next, say, 6 months?
We have, I think, worsened that situation in a sense, in some respects, by virtue of the lockdown approach we took with one worker, one home. We instituted that really early, and I noticed several other jurisdictions then followed suit. We had the advantage, though, of having no COVID in long-term care, whereas BC, for example, did it later and have had significant number of outbreaks. That has now been lifted, so that element of staffing shortage can be addressed immediately. Medium term, we have an enrollment increase in both homegrown licensed practical nurses and PCA courses. They've been started in new areas. I think there's somewhere of the order of 96 new additional seats for PCAs and maybe just over 115 for LPNs. Now, PCAs, their course is now 26 weeks, so there is a time lag. LPNs is obviously longer at 18 months. So those are structural things that we can work to address. I think some of the issue is around staffing to acuity. Some of the issue is around management of sick leave and vacation leaves. And we're working closely with the unions to find out what they feel would be solutions that we could use in the immediate short term. We have a provincial working group with the unions, and we have a more focused one to deal with the specifics in Eastern Health, and both of those are meeting this week. One actually I think has already met, and the other one is meeting shortly.
Okay, thank you. And I wanted to get an idea. We discovered today that health insurance companies in Canada have generally saved billions from just canceled health services, health and dental services. Is the same true in the government? Has the government spending gone down, or has it gone up because of COVID-19, or has it broken even? What would you generally say is the status of health spending at the moment?
Well, we've had kind of puts and takes, to use a phrase one of my colleagues in finance uses. So we have had less of a spend on some of the planned procedures, but we have had staff called in on a regular basis. We have had, to cover COVID eventualities, we have had lower levels of activity in outpatients and these kind of things. But on the other hand, we've needed to put in place measures to screen and advise and shepherd visitors through hospitals and that kind of thing too. There is some federal money coming on this end, but again, on other ends, we have, through various provincial and federal schemes, paid for essential work, and there's been a top-up through the feds. We guaranteed basically income for physicians so long as they were available to provide additional services, and we guaranteed a minimum for them for those so that we would not lose their services for less urgent things. So overall, it's a little difficult to say exactly where we are. I think part of that may become apparent in the budget speech over the course of the next week.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Other provinces have been tightening restrictions for testing, especially for kids, with what you describe as sniffle season upon us, even in places where they currently have community transmission. Considering that we've tested lots of children here, found no cases, where are we on whether or not we should tighten criteria here to just target people who are either sicker or more likely to actually have COVID?
Yeah, I mean, I think some of the other jurisdictions, quite frankly, have done it for a combination of reasons. One is their testing capacity cannot meet the demand that's placed on it. I think if you look at Ontario in general, they virtually threw the doors open to anybody who wanted a test, and there are stories, how true they are, I can't verify, of people having multiple tests, one before going to visit granny and one before partying with the friends. To the point now where people with symptoms can't get in. I know our public health have looked at the issue of the symptom list in relation to children, and it is under regular review. There's no change planned as far as I'm aware at the immediate short term, but the comment is actually more appropriately addressed some way through looking at the criteria. It says, if your child has newly developed these symptoms and does not normally have them, that's a trigger for your COVID screening list. I think sometimes the difficulty comes where parents are used to their child having a runny nose between September and Christmas, but maybe when they're reassessed at school, there is a different view taken. That's something we're working with public health to try and clarify. But at the moment, the short answer is we're not going to change the criteria, but we keep reviewing them.
And with the cases rising elsewhere, as you mentioned, are we looking at tightening, for example, who gets exemptions or putting any sort of additional border controls in place?
At the moment, the system we have seems to be working, and the numbers are what they are. They speak for themselves. I think we would only consider changing those if the advice of public health was there was a need to do so. So, if the surges that you see in BC or Ontario suddenly start popping up in PEI or New Brunswick, that would tell a different story. And similarly, trying to relax them, at some point, you have to realize that we're not doing them because we want to or we feel particularly disinclined to be nice to people. It's because we feel we need them there to protect the general population of the province. And I would argue that those measures are working. Our case numbers are very low and have stayed that way for a while.
Thank you.
Our next questions are from Linda Swain of VOCM News. Please go ahead.
Minister Haggie, pharmacists will be providing flu shots free of charge to the public to make vaccines more accessible and ease pressures on the system. They indicate to us that they're also open to administering COVID tests, like what's happening in Ontario right now. Would pharmacists be considered for providing COVID tests if we see a sudden surge here?
I think we would not rule out any option. I think the challenge around testing remains the criteria, and we have kind of defined those. The rest of it then is an issue of accreditation, laboratory performance, and these kind of things. So those are discussions that have only been mentioned, really, rather than entertained. But again, we have the capacity at the moment. We have the capacity on our lab as it stands to actually multiply our daily tests by possibly a factor of 6 if we needed to. And we have further expansion of laboratory capacity planned for the early new year. So at the moment, we don't see the need to introduce another untried or untested mechanism to the testing scene.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi, Minister. Can you give an update on testing time for people who are looking to, the amount of time it takes to get a test for someone looking to get a COVID test?
We had some challenges, particularly in Eastern Health. We are aiming for, and I do believe we're achieving for a significant number of people, a 48-hour window from the appointment call to actually getting the test. The turnaround of the test is done in 2 batches each day and is really determined by where the sample comes from. So, for example, if it has to travel from Labrador, it's obviously dependent on flights and would take a little bit longer than, say, a specimen coming in by road from Gander or by air from Gander. So we have, again, the opportunity for people whose tests are negative and who've registered to go on the COVID website and get their test result to try and shorten that process down. We are in a lot better place. My information from Ontario is that it's taking anywhere from 4 to 5 days to get a COVID test and a similar length of time simply to get the result. So those are our benchmarks, and exactly how many, what percentage are achieved by that time, I could certainly find out for you if you'd like a number for it.
Can I also ask, a few weeks ago you mentioned that Eastern Health was looking into an online booking system. Can you give an update on where we're at in terms of that process?
Yeah, they have an online booking system which is being trialed through Major's Path for blood collection. Given the demand and the issues around public health appointment testing, the fastest workable solution to deal with the volumes was for effectively Eastern Health to set up a call center type of arrangement. They have done that, and I think in the fullness of time, I'd love to see them move to online self-scheduling, but we're not quite there yet, certainly not for the levels of demand that were generated when school restarted.
Jody Cook, do you have any further questions? Peter Jackson, do you have any further questions?
Yes, if you don't mind. I wanted to follow up on that online system. I know of one particular instance, I'm very personally aware of it, where a test for time to blood work was supposed to be done this month and can't be done for a month away. This is the kind of system in the past where you could just go in and wait, whether it's for half an hour or 4 hours. So isn't that a bit of a problem that routine and sometimes a little beyond routine blood work is being delayed that long?
Yeah, I mean, that specific to me would not be a routine blood test. It would be a scheduled blood test. And if the timing is important, that elevates it from, I think, out of the self-scheduling module. I think that would then be an issue for the ordering care practitioner to actually indicate that on the form and to make arrangements as if it was urgent or semi-urgent, because it's not a routine blood test.
Okay.
Peter Cowan, do you have any further questions?
I'm good, thanks.
Linda Swain
No, I'm good, thanks.
and Patrick Butler.
Yeah, I just have one last question. You mentioned the reviewing the success of the loosening restrictions or this pilot project for rotational workers. Will part of that review also be looking at broadening that beyond rotational workers to other travelers?
I think in the first instance, we'd like to assess the change we made. I think the ability to broaden it to other travelers outside of the rotational sphere would really very much depend on the demographics of the location. And, you know, rotational workers travel because their job requires them to. They may not be essential workers here, but they have to travel because of the nature of their job and a work site or a campsite. The other reasons for travel are the reasons that we had the exemption mechanism put in place. You know, if you don't need to be traveling, you probably shouldn't be traveling at the moment, particularly given the situation in the Big Four, British Columbia, Alberta, Ontario, and Quebec. And there is now talk that Manitoba is starting to see some challenges in keeping its numbers under control. So again, we can certainly look at it, but that would very much depend on what's happening elsewhere in the country. And at the moment, if I were a betting person, I would feel that public health would not be inclined to relax too much in that regard just at the moment because of those numbers.
So, sorry, will it be part of that review or not?
The fact is, this review was about the safety for rotational workers. The question you're asking, and I answered it that way, is actually a separate question. These are not, I assume, the way you phrase the question, rotational workers. Therefore, they're not covered by the pilot scheme, and nor were they intended to be.
Thank you.
Before we conclude today, Minister, do you have any final comments?
No, I think, really, I'd just like to reiterate that we are doing well, and we're doing well because of the collective effort. I go out to the stores, people are wearing masks. I go out in public places, in government buildings, people are wearing masks, and they are doing their level best to keep their distance, and they are to be applauded for doing that. I think the numbers are good because of that, and because of that, the numbers will remain good as long as we keep doing it. So to coin Dr. Fitzgerald's phrase, we need to hold fast. And I think with that, I'd close and thank everyone for the time and attention.
Thank you very much for tuning in, everyone. Have a great evening.